Welcome everyone. I'm back again. It's Matthew McKenzie, care activist, and this time I'll be presenting on why mental health carers end up getting ignored. And when I say getting ignored, I'm talking about my services, and that's probably going to be, I would say, mostly mental health services. This is not always the case, don't sort of get it wrong. Some of the services do excellent jobs in supporting and engaging in mental health carers. And obviously, when I'm talking about mental health carers, I'm talking about those who are caring for someone with mental ill health and they're unpaid. So it's more likely going to be a family member or a friend. So basically, what is a mental health carer? And I've done actually a video on this already. So I'm only going to explain briefly, but if you want a more in-depth sort of video, you can search my channel and look for basically what is a mental health care. I'll look up on that one. I'll explain again some of the basics. I'm going to do a longer video regarding what mental health carers do, because there is a lot. But we've ended up in a situation where mental health carers are facing challenges. I'm just giving examples of what to expect if things don't go your way when you're caring for someone who has mental ill health. But okay, basically, mental health care is someone, often a family member, as I've mentioned, or a close friend, who provides unpaid support and care to an individual experiencing mental health challenges or mental illness. Now, the role can involve, a wide range of responsibilities. And remember, I do have a video on this, so do search around for that. From providing emotional support mainly to helping manage daily tasks and medicational need, and also advocating and engaging on the patient's behalf, depending on unwell and the type of mental illness. Mental health care is actually crucial to the well-being of the person they care for. But, there are times, and it's a shame, but there are times when they don't receive formal recognition. And this can lead to them being ignored because of the role they play. So we're going to look at that on, how and why mental health carers can often end up being ignored. But do remember, this is not across the board. As mentioned, there are plenty of mental health services doing their best for families and carers, but there are times, and you'll see examples, when mental health carers do end up being ignored. So basically, one of the big problems of mental health carers is that it can be an invisible role. Several reasons for this. You can't often see mental illness. It's not like a broken leg. It's not like a broken arm. It's nothing physical, unless, I suppose, when someone is at the chronic situation. So when you're thinking of a mental health carer caring for someone with mental health, you just don't often see them. So carers often go unnoticed in the mental health sector. Their contributions are essential, but not often that highlighted. So there can be a certain lack of formal acknowledgement when it comes to carers, because the services as they stand do not rely on payment regarding carers doing their role. Carers don't pay for the service, so they get on and quietly try to provide care. Not always quietly, because obviously if something goes wrong, I'm sure you'll hear from a family or a friend. So there's a situation where, as I mentioned, carers receive little to no formal recognition in their role, and efforts, because it's unpaid, can be taken for granted. Just get on with it. The systematic oversight of carers is that the system often overlooks the needs of carers. It can be patient-centric. And the reason, I suppose there's several reasons, but one of the main ones is that the health system is looking for the one who is most in need. So it focuses on the patient. Policies often really address care's well-being. So again, it's the patient sort of centric issue. Don't get me wrong, there are policies that do, but across the board, there are times when they don't. And unrecognized contributions would lead to carers' work being undervalued. and the impact on patient's recovery is significant but ignored. So again, you've got the problem of also the impacts of societal stigma, and it's doubled because obviously when you're caring for someone with mental ill health, there's still a lot of misunderstandings regarding chronic mental health symptoms. So I'll jump the gun a bit here, but stigma around mental health affects carers too. It's not just the patient. And carers can face judgment and misunderstanding in their role. So mental health carers can often be ignored due to prominent focus on the patient needs. I'm mentioning the centric view the health system takes on the patient because of their needs. There's limited resources and funding as it stands, and this can contribute to oversight of carers. Like carers can be ignored because of the resources and funding are desperately focusing on the patient. There's assumption of continued support, and this can lead to neglect of carers. The system sometimes expect carers to sort of be there because they feel the carers can be emotionally tied to the patient, but then there's a limit to how much families and carers take. There's a limit when they start putting barriers up or refuse to provide care and support or walk away from that role. As mentioned, there's a stigma around mental health, and this extends to those caring for the mental illness. This can obviously lead to further isolating carers from other members of the families, from the community, from even seeking support. And unfortunately, as it stands, there are gaps in legal and policy frameworks which fail to adequately address the specific needs of mental health carers. So how does this impact on carers that often can end up being ignored? What is the impact of all of these things that I've mentioned? Well, there's emotional burnout. Carers are constantly battling to save their loved one, and they're constantly battling to engage and get engagement from the mental system. Then mental health carers experience emotional burnout due to the demanding nature of the caregiving, juggling daily responsibilities. Emotional support can eventually take its toll on the carer's mental well-being. We all have mental well-being, but we all must protect that as well. There will be situations when the carer will be feeling overwhelmed. Carers can report feeling overwhelmed by the practical tasks involved in caring for someone with mental illness, obviously managing medications if the patient agrees with the carer's involvement. Dealing with appointments, daily routines can also be exhausting for the carers. And as mentioned earlier, with the support services, there can be a lack, and in fact there is a lack of respite care. Support services contributes to the emotional and practical exhaustion experienced by carers. Without adequate breaks or assistance, carers actually begin to struggle to maintain their own well-being while trying to care for their loved ones. So there's several recommendations. I'm going to mention two organizations, one being the National Institute for Health and Care Excellence. That's NICE for short. Then I'll move on to the Triangle of Care. So NICE recommends specific services for mental health carers, including mental health support, counselling, which is a big one actually, and respite care. There's a problem with these recommendations, not really enforceable. But however, the recommendations are very good. This will be excellent if mental carers can get hold of these things. Then we've got involvement in care planning. NICE suggests involving carers in advanced planning and decision-making progress to enhance their sense of value and support, rather than being ignored and then later being told to get on with it. There should be also education of health providers, and NICE emphasises the importance of educating health providers on recognising and supporting unpaid mental health care. This basically means providing care awareness training for those who work in the healthcare sector, especially mental health sector. The last thing here NICE recommends, and I recommend quite a few other things, this is only just the basics. So the advocacy for policy changes. Now, NICE advocates for policy changes that provide financial, emotional, and mental health support to unpaid carers. Remember, there are policies that don't really take into account the mental health carer's situation, and one day we'll list those out. So the last bit will be on triangle of care, something I'm heavily involved in. But what can triangle of care do in regarding improved care engagement? Well, the triangle of care is a model which is widely used in mental health services, especially in the UK, although it's beginning to be used outside of the UK. The idea really is to create a more holistic and inclusive approach to care. Obviously, there's 6 standards. I've not really listed them. I will go into triangle care in another video, but I'm just pointing out the basics that can help mental health carers not be ignored, but be recognised for their efforts. Going back to the triangle care, it basically helps ensure that carers are often significantly emotional, practical, and sometimes providing mental support are acknowledged as key partners in the care system. The triangle of care in itself is a collaborative model designed to improve the involvement of carers in care and treatment of those with mental health conditions. Now, it emphasizes, as in a triangle, a partnership between carers, patients, and mental health profession. They are all talking to each other. It's not linear. It's each different point of that triangle all connected. And basically, it's to ensure everyone involved is in the care process, that communicates effectively, and that they all work together in the interest of the patient, with support for the carers being recognised by the mental health professional. Well, that's it for this short presentation of why mental health carers end up being ignored. It is a shame that it still goes on. I suppose we can understand why in certain aspects, and I suspect this would be resource problems or staffing issues. But it needn't be that way. It's always good to learn from the other organizations that, creative and think out the box in regards to engaging families and carers. If you like this video, if you enjoyed watching it, please do a like and feel free to subscribe. Thank you for watching.